Alright, okay, so hello dears. hello. I hope you're having a good day, no? And I hope you're doing well. So welcome to the last, yes, the last na yun. And the second miscellaneous serology topic. And this is the serology of other infectious agents. Okay, so this is the last lecture in IS Lab. So we're focusing now. In this lecture, what we're going to talk about now are the different agents of disease and how they are diagnosed serologically, right? So we'll talk about the other bacteria, viruses, yes, other viruses, parasitic, and even some fungi or fungal agents, alright? So maybe medyo marami-rami na mag-chika, tas nagugutom na ako. Kulang pa siya tulog, but anyway, laban lang. Alright? This is the end, and I hope lang yun. I'll be able to explain pa rin properly. Alright, so again, this is the serology of other infectious agents. Okay, so for a short introduction, again, for a microorganism to be successful in establishing infection in whatever, when whoever, and wherever, it must first, of course, pass through the defense systems of the host or of the organism that it's trying to infect. Okay, so it needs to attack, or it needs to counter-attack, it needs to survive the defense systems of the host, alright? And once they survive, makapass through sila sa different defense systems of the body of the host, then they're now ready to infect, okay? Alright. And for the serology of other infectious agents, in this lecture, what we're going to focus lang are some of the agents, okay? And we'll start first with bacteria, starting first with the other spirochetes, Borrelia and Leptospira, and of course, your Recaptcha organisms, alright? And for viral agents, we're going to focus on rubella and rubeola, the mumps virus, or the mumps, and of course, the dengue virus, right? Because very common in the Philippines, okay? And for parasitic agents, we'll focus first on toxoplasmosis or Toxoplasma gondii, and of course, rapid tests na lang for other parasites. And lastly, for fungal agents, we're going to focus lang on the systemic mycosis, alright? The agents that can cause systemic mycosis. Alright, okay, so we'll start first with bacterial agents, other bacterial agents, with your spirochete serology. Starting first with, of course, Lyme disease, alright? And Lyme disease is, of course, caused by your Borrelia burgdorferi, okay? So Borrelia burgdorferi is, again, a spirochete. It's part of the BLT natin. BLT, yes, not sure remember. Basta, memories, BLT, nato na mnemonic for spirochetes, Borrelia, Leptospira, and Treponema. So Treponema, we have discussed in our syphilis serology, no? And for this, we're going to start again with Lyme disease. Again, Lyme disease caused by Borrelia burgdorferi, okay? And it is transmitted usually from the bite of an arthropod, okay? And that is your tick, T-I-C-K, your deer tick or your hard-bodied tick, in the species of, or in the genus of Ixodes spp. Now recall, remember ba sa para, there is this one parasite that also has this vector as its, or has this tick as its vector. Can remember pa? Kinsa to siya na parasite, letter B gyapon. It's your, of course, Babesia spp. Babesia microti, Babesia divergens. Alright, so it can be transmitted by the same tick that Borrelia harbors, okay? That is why, if you have borreliosis or Lyme disease, you can also have the chance, you can also have the possibility of harboring or having babesiosis or Babesia. Because again, they share the same vector. Nako, press the buzzer, dalawang B, Borrelia and Babesia. Okay, and again, from the bite of an infected tick, your Ixodes. Alright, the stages of infection, we have 3 stages. Number 1, it starts first off as a rash, okay? Followed by dissemination to multiple organ system, and lastly, late disseminated na. So, na-disseminate na siya sa all over your body, which includes na arthritic symptoms. Okay. Now, the clinical hallmark of your infection is, of course, the bullseye rash. Early infection, bullseye rash, also known as your erythema chronicum migrans, ECM, which is at least 5 cm in diameter. Okay, so recall, mga bakte dyan, yes, sa spirochetes ninyo na lecture, yes. Okay, so yeah, so again, bullseye rash, hallmark of early infection. Okay, bullseye rash. Ako, bullseye rash. Your erythema chronicum migrans. And this is the picture, diba? So, martial bullseye. There's an inner red and an outer red. Bullseye rash, hallmark for early infection of Lyme disease. Then for early dissemination, after early infection, of course, it disseminates now via the bloodstream, and it involves your skin, the nervous system, heart, or joints can also be affected. Alright. And the most prevalent neurological sign is facial palsy, meaning one side of your face, kaya dili na siya maliho, or move down na ba siya, or dili na siya maliho. Na peripheral neuritis, inflammation of mga nerves in one side of your face. Okay, that's the neurologic sign. Most prevalent neurologic sign of Lyme disease, okay, is facial palsy. Alright. And major manifestations of late Lyme disease, if dili siya maagapan, arthritis, peripheral neuropathy, and encephalomyelitis. So inflammation of the brain, alright, encephalomyelitis, inflammation of the covering and all of the brain, mga tissues. Okay, alright. So Lyme disease again, hallmark, bullseye rash of early hallmark of early infection, bullseye rash, also known as your erythema chronicum migrans. Okay, alright, ayan, so ECM. Now we go now to laboratory diagnosis. For diagnosis, because again, it's quite common in the US because they have the vector there, they have a lot of deer. So for diagnosis, it's usually a combination of clinical findings, a history of exposure in the area, no, especially if it's an area that is endemic for the ticks, no, endemic for the disease. So you need to look at the history. And aside from that, also we look at the antibody response. So we're talking, or we're detecting antibody, not the antigen. Okay? So antibody response, except lang if it's still in the early stage, lapay bullseye rash. Because again, that's diagnostic of early infection. The appearance of the bullseye rash can already point to an early infection of Lyme disease. So you don't need to test for antibody. But if it's already in the late stage or early dissemination stage, then antibody response is also tested for diagnosis. Okay? Alright. Now we go now to your serological diagnosis. Again, we test for antibody, but it's variable and may only be detected until mga 3 to 6 weeks. So medyo matagal-tagal pa. 3 to 6 weeks after the tick bite. Of course, IgM appears first, and IgG, it peaks at the 3rd and 4th weeks of infection. So medyo matagal-tagal pa. Alright? So it's much more applicable for mga late or mga disseminated na Lyme disease. Now, for CDC recommendation for testing antibodies, we follow a two-step process. The first process is we perform an enzyme immunoassay or indirect immunofluorescence assay. And if it's positive, if it's negative, we do not perform further testing. But if it's positive, we proceed to the second step. And the second step is using immunoblot or Western blot. Okay? And a positive result is considered to be positive in both the first step and the second step. So dapat positive siya in EIA or IFA, and positive po siya sa Western blot. Okay? So that's the two-step process for testing Lyme disease antibodies. Okay? That's according to CDC. Alright. Now we go now to your different serological tests. Starting first with ELISA and IFA. For ELISA, it's considered to be the standard test method for testing its antibodies. It's most widely available. But the sensitivities of both ELISA and IFA are quite low in the early initial 3 weeks of infection. Okay, bago pa man. Alright? So, false negatives are common. Alright? So, sa pag-test. Now, IFA test result considered positive if our titer is about greater than equal to 1:256. So, dito pa siya considered significant. Okay. Alright. And again, these tests are prone to false positive. So, if na yung mga positive antibody results, it should be correlated again with clinical data, with history of exposure, and epidemiological information. And again, as mentioned by CDC, if positive with ELISA and IFA, you proceed with the second test, which is your Western blot. It's used as confirmatory test, but again, we discussed Western blot in HIV. Again, Western blot, it's really difficult, complex ang pag-interpret pa, so you need training. And it's similar here in your Lyme disease, okay? And the Western blot pa here is much more complex now compared to HIV testing. So, yes, combo-combo na, doble-doble na ang challenge. Okay, alright. And what happens is, again, still the same, Borrelia antigens ang imong electrophoresis on the membrane. And then you react with the patient's serum, and then after reacting, you wash to remove unbound antibodies, and then you add an AHG which is usually enzyme ang naka-attach. Okay? Alright. And then we look at the 10 proteins. 10 proteins sa Borrelia. They are designated by their molecular weights. You have 18, 23, 28, 30, 39, 41, 45, 58, 66, and 93 kDa. So, 10 ka-protein. So, muna kayo siya, so, kanang super sick, asa na? Kanang sa loto, kanang 642, marang ganun. Okay. Itayan na ninyo guys. Okay, mas hindi ay magawas. Or, mamilyonaryo mo, yes. Mamalato na mo years na. Okay, charot. Alright, okay, that's for Western blot. Now, we'll focus more on the Western blot. When is it considered positive? So, a positive siya for IgM antibody if 2 of the bands are present. So, 2 of the bands, 23, 39, and 41. So, 23 is also known as the OSPC na antigen sa Borrelia. 39 and 41, which is also considered as the flagellin na antigen. Okay, so 2 of the 3, 23, 39, and 41. 23, 39, and 41, any of the 2, kung positive siya or naaang band, then it's considered to be positive for IgM. Now for IgG, it's positive if any 5 of the 10 ang positive. So any 5 out of 10 ka-proteins, if any ang naaato sa bands na naa, then that's considered to be positive for IgG. So here's an example of a result. So number 1 is your reference lane, and number 2 is the serum. So as you can see, 1, 2, 3, 4, 5, 5 ka-proteins are positive. So therefore, this sample is positive for Lyme disease. Okay, for IgG antibody. All right. Now, nigawa sa boards, yes, not during our time, but a recall lang siya. Gi-mention ng antigen. Ang gibutan nila is OSPA antigen. Okay, OSPA antigen is present. So this is found in diseases caused by, press the buzzer, of course, Borrelia. Alright, or if wala Borrelia, Lyme disease. Okay, alright, so muna lang ligamit, OSPA. Alright, so OSP, basta OSP, outer surface protein, OSPA, B, C, D. Mula yung ligawas. I think ang OSPA ang ligawas. Okay, so this disease ba, or this organism has OSPA, or OSPA was detected in the serum of the patient. This is found in patients, or this is found in patients infected by what organism? Press the buzzer, Borrelia, Burgdorferi, or if wala Borrelia, Lyme disease. Okay, alright, ayan. So lumalabas sa boards pa rin. And of course, the more accurate, the more specific, or more sensitive palaga, but high-end na ng mga test, molecular method, PCR, it can detect DNA to as few as 1 to 5 organisms. So high specificity, that's why you can diagnose early Lyme disease. Okay, it's useful for diagnosing early Lyme disease, even if wala pa antibodies, di ba? Because again, antibodies appear pa mga 3 to 6 weeks after infection, or after the tick bite, sorry. Di ba? So, very talaga ang molecular methods. Okay? Alright, that's for Lyme disease, o di ba? So, very naman. Always take note on the test, ELISA and IFA. ELISA is a standard method. IFA positive siya if the titer is greater than or equal to 1:56, and Western blot is a confirmatory. Okay, positive for IgM if 2 of the bands are present, 23, 39, and 41. Okay, and positive for IgG if, again, any of the 5 of the proteins are present, any of the 5 bands lang na. Okay, alright, and again, recall, OSPA, asa daw na siya gikan? Borrelia burgdorferi, or seen in patients with Lyme disease. Okay, alright, so that's for the first spirochete. Next, we go on to the second spirochete, or second disease caused by a spirochete, and that is leptospirosis. By the name itself, leptospirosis is caused by the agent or the spirochete Leptospira interrogans. Okay. For humans, usually they become infected. You already know that, diba? Very common in the Philippines. Diba? We get it through direct or indirect contact with contaminated water or food even, I think. Yeah. Usually water, urine. Contaminated with the urine or blood of animals. So the leptospirosis, or your spirochetes of Leptospira, they enter the humans through breaks in the skin. So naka mga wounds, mucous membrane, and even sa eyes, conjunctiva. Okay, alright. And pathogenic Leptospirosis, again, they invade the bloodstream after entry and they spread all throughout the body. Okay, especially maabot sila sa CNS and even kidneys. Okay, alright. Symptoms begin about 2 to 20 days after infection and include fever, headache, and myalgia. Non-specific tayo. Alright. And we have 2 stages. The first one is what we call anicteric leptospirosis. It's actually self-limiting, and it's usually septicemic stage, so you feel like feverish. Alright. And the Leptospirosis or your organisms are in your bloodstream, okay? And it's characterized with high fever and severe headache. And after the anicteric leptospirosis, it's followed by the immune stage. And the immune stage, the hallmark there is aseptic meningitis. So nabot na siya sa brain, okay? It can cause now aseptic meningitis. When you say aseptic, it's not caused by bacteria. So there's no pus or whatever. So aseptic meningitis, okay? Alright, ayan. So in the anicteric leptospirosis also, after 3 to 7 days, IgM also starts to appear, okay? Your antibody starts to appear. And the most severe, if it's not addressed, is your Wales disease or icteric leptospirosis. Whale disease. Oh, whale. Charot. Okay. Here, it's the most severe and involves now the other organs, especially your kidneys, liver, and vascular dysfunction. And it can lead to death. 10% of the patients with whale disease leads to death. Okay? Because again, it involves now kidneys, your livers, and even lungs, pulmonary hemorrhage. Okay? So it needs to be addressed as soon as possible in leptospirosis. Okay. Alright. And here's an example of your Leptospira interrogans, of course. This is your spirochete, but for Leptospira interrogans, very characteristic shape, yung figure, compared with the other spirochetes, is the hook ends. Ayan, this one. That's why it's called interrogans, because it looks like a question mark, di ba? So, nasa yung hook ends, and then, ayan. So, dito sa hook end. Para siyang question mark, para ganun. Okay? That's why it's called Leptospira interrogans. Again, Leptospira, hook ends resembling a question mark. Yan, lumabas daw sa inyong exam sa una. I remember sa intro to micro, when there was this, I think some of you told me that, sir, nigawas ng spirochetes, pero ang question kayo, spirochete with a hook ends that resembled a question mark, parang ganun. And then I did not mention that when I talked about spirochetes. So like, wala ko shock, sorry class. Wala na ako na-mention dyan. I thought maganda dili pa need, pero nigawas na siya sa exam ni Ma'am Gemma. So, apologies. But now you know, after you're back then, and now again, review, hook ends, okay, looks like a question mark, Leptospira interrogans. Okay, alright, ayan. So, that's for introduction to leptospirosis. And of course, a little facts lang, no? Leptospirosis in the Philippines. Again, it's endemic because again, you know, our place is very, very prone to flooding, no? And of course, marami tayong mga rats dyan, okay? Marami tayong mga RAT, mga besties, diba? So, mangingi sila, alright, in the flood. So, of course, it's endemic. Average of 680 leptospirosis cases and 40 deaths every year. So, ang prevalence is 10 people for every 100,000. So, it's quite prevalent talaga. Alright, so it's really common. Of course, seasonal siya with a peak incidence of July to October because again, that's the rainy month. So, more flooding, no more floods na may tabo. Alright, so more chances of being exposed. Okay. And in 2020, thankfully, there's a 66% drop in the cases of leptospirosis. But for October 12 to November 14, 228 cases of leptospirosis were recorded, and most coming from Metro Manila, of course, followed by Camarines Sur and Rizal, and the third is sa Cebu. Okay, so as you can see, they're mostly found in mga highly urbanized places or mga na-adjoy, mga really prone to floods. Okay, Metro Manila na as in, like legit when I was there sa pag-review, and kanang sa review na mo is of course sa Moraita, UST. Just, oh my gosh, if magulan, so nag-review me until nag-start May until September, and those are rainy months, so very common ang flooding years. And mabuto siya sa UST dapit, my favorite. UST, I miss Moraita and all that UST kayo. Mabuto siya diri, Usahay, no? So, Usahay, of course, magulan na sa amuhang dorm is sa Sando, San Lorenzo Ruiz. Very, very malayo pa. Medyo malayo pa from the review center in UST, pero na rin mga shortcut, pwedeng agihan. So if magulan kami ni MJ, yes, if you know him, akong roommate. If magulan na gani na, dili namin mo tunga sa review. Kaya kabalo namin na magbaha, niya labi pa dyan katulong, so dili na mo ito sa review. Okay, so magano lang, mag-food trip, mag-chika, mag-movie march, at ganun lang. Di ba, marag wala ka review. But anyway, yeah, so very common talaga there, especially sa UST, dara napita sa Moraita. Grabe yun ang flooding there sa regard sa anong area sa dorm. So, I think naka-experience si MJ na nag-flood. Lisod yung kayo siya dears. Like, lisod yung kayo mag-flood yun. So, if di ka prepared, like, casual lang ka na, imong shoes kay puti pag yun and all that, wala kang expect na kaulan. Wala kang expect na na-flood. Ayan, so, lisod kayo, oh my gosh, as in. Anyway, those were the days coming out, but yeah. So, balik na din very endemic. Because again, flood-prone kayo areas. Okay. Alright. And especially, muna siyang if rainy months, if you were na-expose ka, ni sulong kag baha, na-expose yung skin, wala ka ng boots, na napadyo kay saman, always after, if mo man sa baha, attitude ka dahil sa mga sentro or sa mga doctor and ask for a prophylaxis. Always have a prophylaxis post-exposure, and that is doxycycline. That's an antibiotic. Okay, and the duration is dependent on the degree of exposure and presence of wounds. Okay, all right. So that's for little background in the Philippines of leptospirosis. Again, endemic. All right. Okay, ayan. Now we go to your lab DX. Of course, bacteria culture is the definitive diagnosis, but again, that could still be challenging because again, it's for spirochetes, diba? Your culture media are not usually the new normal culture media, diba? So we rely on other methods. Dark field microscopy, of course, because it's a spirochete, it is recommended, but it's not used to establish diagnosis. Alright? And aside from that is, of course, serological and even molecular methods. So we go on to the serological tests. The first one is your microscopic agglutination test, or MAT. This is considered to be the reference method. Please take note. Reference method for the serological diagnosis of leptospirosis. What you do is patient sera, you react with live suspensions of the spirochetes, and then you read by dark field microscopy. Then you look at the highest dilution of the serum, which 50% of the agglutination occurred. Okay, so that's MAT, microscopic agglutination test, the reference method. Because there's another test, if a single specimen, the titer is greater than or equal to 1:800, a probable leptospirosis patient. Okay? And paired specimen, of course, between acute and convalescent sera, fourfold increase. Usually, fourfold increase is suggestive of infection. Definitive good shot of leptospirosis infection. Alright, so that's for microscopic agglutination test. Don't be confused because we also have a macroscopic agglutination test. And for this test, this is a slide agglutination test. And it's usually more accessible to the laboratories, and reagents are also commercially prepared. So slide agglutination test lang, murag normal run ng test like sa CRP nato and all that. Okay? But the reference method it's the microscopic. Please take note. Lumalabas din sa boards. Alright. Okay, microscopic agglutination test. Okay. So other tests, we also have rapid tests. For rapid tests, again, mga kits pa rin. So you use broad-reacting, genus-specific antigens to detect a lot of antibodies. Alright. So you have mga brands. We have lepto dipstick and lepto lateral flow, IgM immunoassays, lepto dry dot, which is a latex agglutination test, and you can also perform indirect hemagglutination assays and microcapsule agglutination test. Microcapsule agglutination test, same principle lang with MAT, okay, but this time it uses microcapsules. Alright. Okay. And generally, sensitivity is low during the first week of illness, and then increases to a peak by about 10 to 12 days. Because again, of course, initial pa lang, so wala pa kayo antibodies na produce. Alright, okay. And of course, you have IgM ELISA. If you want to really detect IgM, you use ELISA, and it's much more with acceptable sensitivity and simple to perform then. Okay. Alright, ayan. So that's for leptospirosis. Okay. Alright, because again, IgM detection has been mentioned or has been suggested that it's much more sensitive than detection, than the MAT test, microscopic agglutination test. When the specimen is taken by the early part of the illness. Okay, but MAT pa rin, microscopic agglutination test, reference method. Okay, alright, for serological test for leptospirosis. Okay, so here's an example. This is your MAT result. These are your agglutination. Okay, and this is an example of a rapid test for leptospirosis. So kits pa rin siya, alright? And usually aiming at the detection of antibodies, okay, for leptospirosis. Alright? Okay, so that's for leptospirosis. O, diba? Very fast natin sa mga chika dito, so run through lang. Okay, and for the last bacterial agent that we're going to discuss, these are your Recaptcha, okay? The Recaptcha serology. Now again, we discussed this in your bacteriology. Recaptcha are obligate fastidious bacteria. They are considered to be obligate intracellular parasites. So do not be confused na parasites ang gigamit. Because again, they are bacteria, okay, but ilahang mode of living similar to parasites in the sense that they need a living cell, they need a host for them to live, for them to survive, okay? So Recaptcha, same na siya with, diba, same family or same group with the chlamydia, not mycoplasma. Chlamydia, Recaptcha, di ba, mga Coxiella, silang tanan, they are obligate intracellular bacteria or parasites. They need, obligate talaga, they really need live cells because if not, wala sila sa live cells, they will die. Alright? Okay. They are gram-negative, pleomorphic, and multiply by binary fission. So, in the cytoplasm of cells. But again, the point is, they are obligate intracellular parasites. Okay? Similar to your viruses. Again, do not be confused if we use the word parasites here because they're not talking about the organism as its molecular or genetic material as parasite. But it's described as a parasite in terms of the living, mode of living nila. They need live cells, they need hosts for them to live and them to survive. Okay? Alright. Ayan. Mode of transmission, again, two ways. It could be from the bite of an arthropod vector. Arthropod vectors can vary, again, from ticks to flies to whatever, okay? And it can also be transmitted through infectious aerosols, inhalation of infectious aerosols. Spectrum of disease, you have 4 groups, no? For Recaptcha, you have the spotted fever group, you have the scrub typhus group, and the typhus group. Okay, three groups na pala. Spotted fever group, the typhus group, and the scrub typhus group. Okay, alright. Now, Recaptchas are suspected when there's a triad of fever, headache, and a rash from the bite of the vector. Okay, alright. So for lab DX, of course, number 1, direct detection methods through immunohistology. So, night tissue, and then you add mga stains, di ba? Immunohistochemistry. Yes, histotechnics ninyo. And of course, PCR methods. Cultivation, again, not routinely used because again, it needs a high-end mga materials. And of course, serological tests. The primary means of diagnosis is through serological tests. Okay, alright. Now here is a summary of all your Recaptcha group, the spotted fever group, the typhus group, and your scrub typhus group. And your Ehrlichia, Anaplasma, and Neo-Recaptcha. So for spotted fever group, very popular is your Recaptcha C, the causative agent of your Rocky Mountain spotted fever. Again, transmitted by your ticks. For typhus group, epidemic typhus or your Brill-Zinsser disease by Recaptcha prowazekii, and Recaptcha typhi murine typhus. Okay. Alright, and scrub typhus is of course by Orientia chuchugamushi, di ba? I like that name so much. Orientia chuchugamushi. Scrub typhus, its vector is chiggers. And for Ehrlichia traphensis, human monocytic ehrlichiosis, and Anaplasma, human granulocytic anaplasmosis, and you have the Sinetsu fever caused by Neo-Recaptcha Sinetsu. So it's very, for the board exam usually, sa review, hindi na kayo siya usa-usag yun. Table na lang na, and then what you need to do is memorize na lang. Unsa ni siya na species of Recaptcha, unsa na disease, unsa yung vector. Usually, mura na siya for mga Recaptcha. Kato ni siya mga bacteria magunanan sa mga last part sa mga books na hindi na kayo ginatagan. Mga ginaano na lang, gina-skip to site na lang, ginapahapyaw na lang pag-discuss watcher. But anyway, lumalabas na rin naman sa board. So, always take note lang. Alright, okay. So, these are some of the group, the Recaptcha organisms that we look into. Okay. Now, for serological tests, the IFA, indirect immunofluorescence assay, is considered to be the gold standard for serological diagnosis of RMSF, Rocky Mountain Spotted Fever, caused by Recaptcha C. Alright, and we use 2-paired serum again, and we look for fourfold increase. So an acute serum and convalescent serum. Okay, alright. Reference method also for both acute and chronic Q fever. Ayan. For Q fever, this is caused by Coxiella burnetii. Where was spelling that? 1T lang yata. The double. Oh my gosh. Parang double T din pala. Okay. Burnetii. Coxiella burnetii. And Coxiella burnetii is, I'm not sure if it's still a Recaptcha, but I feel like it's still a Recaptcha organism. And for Coxiella burnetii, it can also be transmitted through aerosols. Alright. Aside from arthropod vectors, it can also be transmitted through aerosols. Alright. Si Coxiella burnetii. Causative agent of your Q fever. Okay, so that's for the first test, your indirect immunofluorescence assay. Okay. And for the second, we can also perform ELISA, enzyme immunoassays, Lyme blood, and Western blot. And for the last test for Recaptcha, this is your Whale-Felix agglutination test. Ito yung lumalabas sa mga boards sa Recaptcha, sa IS. Your Whale-Felix agglutination test follows the principle of cross-reactivity of your patient's antibodies to Recaptcha, mo cross-react siya with the antigens found in various strains of Proteus. Ayan. So, antibodies nimo against Recaptcha dapat mo cross-react siya with the antigens of Proteus. Alright? Different strains of Proteus. Alright. Ayan. But it's low sensitivity and low specificity, so you should not rely on it. Alright, because this test is the old test gear, the crude, the old way of testing for Recaptcha. Okay? Alright, ayan. Okay, alright, so we go now to the agglutination test results, the Whale-Felix agglutination test results. Ito yung lumalabas sa boards and what you need to know. Alright? Okay, so here's a table. Ayan. So again, we use Proteus strains. Okay, so how do I remember? We use OX19 and OX2 for coming from P. vulgaris and OXK from P. mirabilis. Alright, so for P. vulgaris, diba, it's OX19 and OX2, and for P. mirabilis, it's OXK. So how do I remember? So kanila, diba, these are numbers. Alright, so how do I remember? They come from Proteus vulgaris. So ang mga numbers, they come from Proteus vulgaris. Okay? And si mirabilis, KM. Ang OXK comes from Proteus mirabilis. Alright? So una ko mnemonic for that. So that I don't forget. Because na may mga questions sa boards, sa review board recalls that Proteus, OX19 and OX2 came from what? Or OX19 and OX2 are strains of, OXK is a strain of Proteus mirabilis, Proteus vulgaris, blah blah blah. Diba? So that's how I remember. Basta mga numbers came from Proteus vulgaris. At ang KM, OXK came from Proteus mirabilis. O, diba? Okay, alright, ayan. Alright. Now we go into the results. Si Scrub Typhus ra ang positive sa OXK. Alright, si Orientia chuchugamushi. O, diba? Orientia chuchugamushi. Now the rest, epidemic typhus, murine typhus, and spotted fever group, positive na lang siya sa numbers. Siya ang positive sa numbers, okay? And negative siya sa K. Alright. And Q fever and rickettsial pox, they're all negative. Dili sila mo agglutinate. So meaning, if a patient, okay, na siya serum, you test the serum of the patient suspected of having a rickettsial disease, alright? So you test the serum and then you add a strain, a suspension of Proteus sa serum, and then mo agglutinate, muna siya principle, na agglutination after addition of your serum of the patient with the Proteus suspension. Okay? Alright. Ayan. So again, take note, Q fever ha. Who is the positive agent? Q fever is caused by what agent? Coxiella. Again, Coxiella burnetii. Alright? Coxiella burnetii. Okay, Coxiella burnetii. Q fever can be transmitted by an arthropod bite, okay, vector, or pwede siyang infectious aerosols, inhalation. Alright? Okay, so that's for the Recaptcha. Again, lumalabas sa boards. Okay, please take note of that. Alright, so again, si Scrub Typhus lang, siya ang positive na siya sa OXK. Epidemic, murine typhus, spotted fever group, positive sila sa OX19 and OX2, meaning na agglutination. Okay, the positive result here means with agglutination. Okay, and Q fever, rickettsial pox, wala. No agglutination sa tanang suspension of Proteus. Nag-i-add. Okay? Alright. Ayan. Okay, now, before I forget pala, antibodies to R-Recaptcha, which is a positive agent of your RMSF, Rocky Mountain Spotted Fever, antibodies will arise or will be detected 7 to 10 days. Okay? 7 to 10 days after the symptoms, after the onset of symptoms. So for treatment to be successful, it should start before 7 to 10 days. Okay? So way before pa dapat mag-treatment na. Okay? Para successful ang recovery, prognosis sa patient. Okay? Alright. Ayan. So that's for Recaptcha. And that's for bacterial agents. Okay? Na serology. Other bacterial agents. So you have Borrelia, Leptospira, and your Recaptcha. Now for the next video, we're going to talk about now the viral agents na mga serology. Other viral agents. Starting first with your rubella. Okay? So I'll see you on the next video.